Well, National Wear Red Day is today, and it's all about women's heart health. But the campaign doesn't stop there. The entire month of February, health workers are focusing on heart disease and women.
Joining us now is Dr. Ravi, a cardiologist with Dignity Health, and Eve Diane Miller, who's sharing her story of survival. Thank you both so much for being with us this morning.
And for rocking your red.
Yes.
Thanks for being here.
Yes, I love the red tie, too. The men can get involved, too, can't they?
Yes, absolutely.
Thanks for having us.
So there's a new report from the American Heart Association that shows deaths from heart disease are down, but of course heart disease continues to be the leading cause of death in the United States. People need to pay attention to what's going on.
Yes, so that's so true. So we have good news because we have really made a big impact in terms of treating heart disease. New advances in medicine, technology, all have helped us lower the risk of the problems with heart disease. But the bigger issue is that the risk factors are increasing in the American population. And people are having higher incidence of high blood pressure, diabetes, obesity. There is increased stress, less exercise, poor diet. So all of those issues are creating a problem.
Yeah,
absolutely. And I think a lot of people think heart disease and they think it's an older person problem. But Eve, you're one of the people who proves that isn't the case. You had a heart attack before you were even 30 years old?
Yeah, 28 years old.
Wow.
I had a heart attack.
Yeah. Take us back to that, because we know the signs are often different in women. Did you even know what was happening?
I really didn't know what was happening. I actually thought maybe I have asthma because I was like short of breath for like about a week. It was just a random day at work. I was leaving the parking lot and I noticed my legs felt like tree trunks. Like I could barely pick them up.
Wow.
And I was feeling short of breath. I did go to the hospital, but I did not stay. I wound up going to the hospital a couple days later because it felt like a mosquito bit me on my leg, and I felt like a sharp pain go up my leg, up my arm, and then I remember seeing a commercial, probably from the American Heart Association, that said something about if you feel pain in your jaw, then you may be having a heart attack. And when I felt pain in my jaw, I was like telling my neighbor, I think I'm having a heart attack.
Wow.
So that's when you left the hospital. Why did you do that?
Because I was like, I'm young, I'm fine.
Yeah, you're like, it's going to take too long. We've all done that. You're like, I can just go home.
Yeah, I mean, after sitting there, I'm like, oh, okay, nothing's happening, you know.
Yeah,
I'll go back if I feel pain again.
And I feel like not only do young people would do this, doctor, but I feel like a lot of women do this. Like, well, it's not that big a deal, or I've been through more pain than this before, this can't be that. What are some of the warning signs, and why don't women necessarily take it seriously when it's happening?
That's a great question. So the symptoms in women are very atypical, and that could go along with just having flu-like symptoms or having a bad day. So the symptoms could be fatigue, lightheadedness, upper back pain, jaw pain, sweating, nausea, vomiting. You know, those are symptoms that could be associated with a lot of things.
I was going to say I have like one of those symptoms once a week. Right.
Very true, and that's what ends up happening. Women come to the emergency room with those symptoms. Oftentimes they get, you know, something for their stomach, something for their anxiety, and we miss heart attacks as a result of that. And the biggest issue where we need to raise awareness and education is that if you're experiencing these symptoms, you need to get yourself checked.
Absolutely. And so, Eve, now that you've gone through that, which I'm sorry that you did, but glad that you're here with us today, what do you want other women to know?
I want other women to know that it's really important to pay attention to your body. It's so important to pay attention to your body and not just say, oh, this is nothing. If it's not normal for you, then it's important to get it checked.
Absolutely. And how important is today? We wore red. We're going to see people wearing red to support you guys. I think part of it is the awareness of the conversation that helps.
Absolutely. I think that's the biggest way we can make a big impact. That will help us catch up with the medical advances that we have in heart disease. If we raise awareness, we lower the risk factors. We talk about things like improving your sleep, increasing your exercise, having a better diet.
Well, there's no need to attack us, doctor. But no, you're right. It's those simple things, though, that really compound in your body after a long time.
Well, and I was sharing with you, doctor, before we went here, I think a lot of women, even though they have raised blood pressure or some of these other things, they attribute it to just, well, it's just my life. there's nothing I can really do, but you're saying there are definitely things we can be doing better.
Absolutely, and those would make a big impact, and that would help increase the better outcomes that we want to see in patients.
Well, Eve, we're so happy to have you here.
We are.
Thank
and
you.
looking beautiful in your bed. Doc, you look great too. Thanks for being with us this morning, guys. For more about heart disease and what you can do to improve your heart health, just head to cbsla.com and click on Seen on TV.